We've been looking at very intensely over the last few weeks to try and put that puzzle together of where we are in our Omicron wave and how that's impacting us in the community, but also in our healthcare system. And this will look a little bit... I'm just going to ask them to relook at... It was at the end slide. Let's see if we can try this again. All right. Okay, we'll start again. So on our second slide here, it'll look a little bit different today because there are some measures that we have been using all along that are no longer able to be representative of the community. So we don't have geographic representation, for example, and we don't have things like the reproductive number because that depends on us knowing how many people each case have transmitted to. And as I've said a number of times, as we've gone through this Omicron wave, we have transmissions that are happening very rapidly, and we no longer are able to do that case and contact tracing because of the shortened incubation period that we're seeing with this wave. So we also need to look at other sources to help us validate what we're seeing and to understand the trajectory of what we're seeing in BC compared to other jurisdictions. So one of those is to be able to look at our case rates over time, our percent positivity, which is reflected in the colors of these graphs, and compare them to what we're seeing in other jurisdictions. And one of these is here, the representation of other jurisdictions in Canada. And so the height of our peak reflects the PCR testing. So we've been at the capacity of our PCR tests for a number of weeks now as Omicron has really transmitted in our communities. But it does give us a sense, because we've been monitoring PCR testing over time, it does reflect the change in the patterns over time. Our test positivity has been very high, and it's been in the 20s for the last little while. We've seen in this past week, particularly, that we've started to see a decrease in the test positivity and in the numbers of cases of PCR positives. And if we look at other jurisdictions in Canada, we see that Ontario and Quebec are slightly ahead of us, not as far ahead as we initially thought in terms of the wave going through. And we are seeing, as well as they've reported today, starting to see that decrease in community transmission in those jurisdictions as well. Other places in Canada are slightly behind us, and they're still very much on the upswing. So these are the types of things that we are using to help us understand where we are now. And of course, because daily cases are limited by our testing capacity and our testing strategy, we also need to watch very carefully hospitalizations and hard endpoints like people who've died from COVID. So this is, again, a reflection of jurisdictions in Canada, the hospitalizations that we're seeing compared to Ontario and Quebec. And what we're seeing is we're all on an upward trajectory in numbers of new people admitted to hospital per day. We're seeing that across the board. If we look on the hospital census on the corner there, what we see is in BC that has been flatter and not as steep a rise as in some of the other jurisdictions in Canada. And I believe, and from data that I'll show you, part of that is because of the measures that people have taken in British Columbia, the measures that we put in place in December to try and slow things down and try and prevent hospitalizations, also reflects who is in hospital. And I'm going to talk a little bit more about that and why we focused our booster dose program, for example, where we did. So this is our epidemic curve, again, in so slide 4. The top line in green is the PCR test positive cases in our community, and those have peaked and around the 1st of January and are starting to go down. So we think that we hit the peak of community transmission in British Columbia probably this past weekend. That's important. There's a number of different indicators that allow us to say that with some certainty, and I'm going to go through those. But we are still at the point where our hospitalization rate is going up, so new hospitalizations is still a concern, and we need to understand who is it that's being hospitalized and what can we do to try and affect that trajectory in the next few weeks. So if we look at it across BC, it's not the same everywhere, and we've seen that. We've seen that this started really to take off, particularly Omicron took off in Vancouver Coastal and in Fraser Health and on Vancouver Island first. We're now starting to see it slowing down a bit in interior health, and in northern health we're still on that upward trajectory. It was starting, Omicron moved into that community later than in other parts of the province, but it really is the highly populous lower mainland that is driving the epidemic curve for British Columbia. And the little bumpy bit that you see in Vancouver Coastal at the top, that's a testing anomaly. And that's because we reached the limit of PCR capacity and weren't able to do additional PCR testing at that period in time. And so that's why a week, 10 days ago, we weren't able to say where we were in this trajectory, because it was unclear if it was just because of testing or if it was because we were seeing a true leveling off. And it's very likely that if we had the testing capacity, we would see a peak very similar to what we see in Fraser Health in Vancouver Coastal as well. So if we look at what has happened in terms of the trajectory over the last month in particular, as Omicron entered into our lexicon as well as our communities, we've seen a bit of a wave that started with younger people. So people in their 20s, 30s in particular, starting off and then moving into an older age group. And this is something that we've seen as well in all of our waves through the last 2 years with this virus. But what we're also seeing is it moves with highly connected people. This has been much faster than what we've seen with any other wave. And what is concerning now and what we need to pay attention to is the fact that we're seeing this uptick in older people now. And we need to understand a little bit more about who are those people and what we can do to try and make sure that we're stopping that transmission for those who are more vulnerable to having severe illness in our communities. We're also seeing a bit of an uptick in younger people, and I'll show a bit more information about that. So importantly, as we've seen this move through the community, we want to know who is most likely to be hospitalized. So looking at the hospital data by age across BC, we see that as well. We are seeing an increase in hospitalization in younger people, and we have more information about who are more likely to be hospitalized in those younger age groups. But more concerning, we are seeing recently a dramatic increase again in people over age 70 who are having severe illness and ending up in hospital. And unfortunately, that's where we're seeing an uptick in people who are dying from COVID as well. So if we look at this from numbers of hospitalizations, the numbers are greatest in the 60 to 79-year age group, but the rate of being admitted to hospital is much highest in people over age 80. We are also seeing a little bit of an uptick in the 0 to 19 in our pediatric age group, and I have more information on that will help us understand who are those people as well. So when we look at older people being hospitalized, what are the differences? What are the concerning things that come up? Well, one of the most important is that we see that the rates at every age of people having severe enough illness that they need to be in hospital go up dramatically if you don't have the protection that vaccination offers. And so even having 2 doses of vaccine before you get your booster dose, it's very highly protective for most people. And that's important. That means that all of those things that we have done over this past 2 years to make sure that we get the best protection possible, the 90% of people in BC who've got their vaccinations, that is helping. That is helping make sure that you don't have severe enough illness as this new strain is spreading that you'll end up in hospital. Where we're seeing that little bit of a crack is in older people over age 70, and even with 2 doses there's still a risk in older people because we don't mount as strong an immune response. And so even if you're vaccinated with 2 doses, it's really important to get your booster dose. And one of the reasons why we have really focused on our booster dose program on older people and people who have immune compromising conditions and are more at risk is because we know that extra dose makes a big difference. So on the next slide, what this shows again is hospitalizations by age, and what you can see is that line on the top. No matter what age you are, hospitalization risk is much higher if you don't have any protection, any immune priming from vaccination. And if you're over age 70, you really need that booster dose too. And we know there's about 50,000 people over age 70 who've got 2 doses of vaccine who've not yet got their booster dose. This is really important right now. It gives you that added extra protection that you need to keep you from having more severe disease that leads to hospitalization. So that's an important thing for us all to recognize. And for those who are younger and feel like you can get through this, we are still seeing high rates of hospitalization in younger people who don't have any protection. And that right now, we talked a little bit about breakthrough and reinfections. So people who have been infected with other strains of this virus, Omicron is more likely to infect you right now and more likely to cause severe enough illness that you're going to need hospitalization if you don't have vaccine as well. So it is important to recognize that as more of this virus spreads in our community, and we have people who are vaccinated getting infected, the people who are not vaccinated, your risk goes up of being exposed to the virus, and after being exposed to the virus, the risk goes up of having more severe illness and ending up in hospital. And of course, the other part of that is ending up in critical care. So what we have seen is even 2 doses of vaccine in older people is highly protective of keeping you out of the ICU and critical care in our hospitals. So yes, we're seeing an uptick in severe enough disease to end up in hospital, but not in ICU. And that's not the case for people who don't have that immune priming that vaccination gives. So when we look at, again, across the board, about 17% of people in British Columbia, and that includes people, young people 0 to 4 years of age for whom there is not yet a vaccine. Those people are right now, 47% of people in our hospitals are mostly adults, so not the 0 to 4, but mostly adults who have not been vaccinated. And 70% of people in critical care in the past month are people who have not been vaccinated. And this is mostly Omicron, mostly Omicron and a combination of Omicron and Delta. And 2/3 of the people who've died from COVID in the past month have been people who have not been vaccinated, from the very small percentage of people who don't yet have vaccine in BC. And this is breaks it all down. It's quite a busy slide. It's what I call the placemat, but it shows you that age is still the #1 most important risk factor for having severe illness, for ending up in hospital, or having complications from COVID-19. And that's really important. And vaccination works. Vaccination protects you from that severe illness. And I think I can't say this enough. That level of protection is what is getting us through this wave without overwhelming our hospital system, stretched as it is. And as I mentioned, the risk profile has changed for people who don't have that protection on board, because we know that even if you're vaccinated, this Omicron is causing infections in vaccinated people, which means that extra protection unvaccinated people had from the community being protected is no longer there. So if you don't have a vaccine on board right now, if you don't have that immune stimulation, that protection, you're at much higher risk than you were even 2 weeks or 6 weeks ago. And if we look at this from the perspective of age standardized, so somebody the same age as me who's vaccinated with 2 doses of vaccine, so not even with the booster dose, my risk if I have not yet been vaccinated is 12 times higher of having severe enough illness that I need to be in hospital, 27 times higher of developing severe enough illness that I need critical care. this is really important right now. It shows us that vaccination is really protective for people having severe illness and staying out of hospital. And this is another way of looking at it. I know when we look at the numbers every day, and there's been a lot of people who have been remarking on the fact that there's more vaccinated people in hospital than unvaccinated people. But that number comes from a much, much bigger pool of people. So your risk of hospitalization is dramatically lower. And I think it's, putting the perspective on those numbers. If you're somebody who doesn't have the protection that vaccines are offering right now, your chances of having a severe enough illness that you need hospitalization are much, much higher. I spoke a little bit about the pediatric profile, so this is slide 16. We have seen an increase just this week in younger people ending up in hospital and needing hospital care. And there's been 9 admissions this week in the 0 to 4 age group and 2 each in 5 to 11 and 12 to 17. Thankfully, we have not seen any of these children yet requiring critical care, and we've got no new deaths in this age group. But this reflects again the fact that this virus is spreading widely in our community, and how important it is for all of us around young people, 0 to 4 particularly, young people, making sure that we're vaccinated to do the best we can to protect them from transmission. We know that the case rates are higher when you don't have vaccine, and the same goes for children as well. We've only had 1 case of a child hospitalized who's been vaccinated. So it offers you protection as a child yourself, for children over age 5. But it also makes sure that we do our best to try and reduce the risk of transmission to others. And it is really important for us to pay attention to that right now. I will say that with Omicron, we're seeing a different pattern for younger people. It's more of an upper respiratory illness. We saw this in the US, we're seeing this in other jurisdictions, and we've been watching it here and talking to our pediatric colleagues. It's what they're seeing as well, that it behaves more like some of the other respiratory viruses in triggering things like asthma and airway disease and bronchiolitis in young children. So that's most commonly the reason why they're in hospital after infection with COVID, and now mostly Omicron. But I will say we do have other respiratory viruses that are circulating this year and are causing illness in young people and in long-term care homes. Last year we didn't see very much of influenza, RSV, we didn't see very much of anything. And partly that's because of international travel and all the measures that we're taking. So the things that we do make a difference in preventing these other infections as well. What we have seen this year is quite a large increase in respiratory syncytial virus, much more like what we would see on a normal respiratory virus season. We still have a little bit of influenza, not a lot this year, but it is out there. And it is causing illness in young people. It's one of the most common reasons, RSV particularly, while younger children are being admitted to hospital over the last couple of months, in addition to the small number that we're seeing related to COVID. The other thing that we're seeing is that RSV can cause, and we've known this, outbreaks in long-term care homes. And the most severe outbreak we've seen in the past month in a long-term care home has been caused by RSV. So those measures that we have in place to protect long-term care homes, they do protect against this as RSV and influenza as well. One of the things I will say is that with so much virus circulating, we have a lot of milder illness caused by Omicron primarily in long-term care homes across the province. And we're working with the long-term care homes, working with residents and families to make sure that the measures that we take are proportional to the change in illness that we're seeing. Partly because we have so much good protection of residents with the booster doses in long-term care homes, and Omicron itself is causing a much milder illness in long-term care for the most part. So those are things that we're working through with the long-term care homes right now. So understanding the new reality that we're in, this new wave of Omicron, and how it has changed is something that we've been adjusting to and trying to make adjustments for over the last few weeks. And this is the whole genome sequencing pattern that we've seen across the province since the pandemic started. And what we can see is the red there is Omicron. And it has rapidly replaced Delta in a much shorter time frame than we've seen any of the other variants emerge and replace over time. And that has meant that it is a different game that we're in now. It's a different pandemic, and we've had to adapt and adjust and make these changes with the imperfect information that we have, and in real time, essentially. So we've seen this replace here in BC in about 4 weeks, which is similar to what we're seeing in other jurisdictions, where it's about 4 to 5 weeks for Omicron to come in and rapidly replace other strains that are circulating. It's not the same across the province. What we saw is it emerged first in Vancouver Coastal and Fraser and Island Health, and moved very quickly there. Little bit later in Interior Health, but now has mostly replaced Delta there, and a little bit later in Northern Health, although it is replacing Omicron. So what does that mean for us? And how do we understand with this rapidly changing virus that, as we've talked about, we now know has a shorter incubation period for most people because of vaccination, has a shorter duration of illness, and most people aren't getting a severe enough illness that they need to be hospitalized. That's the good news. The challenging part is understanding where we are on the trajectory in terms of transmission in our community, and also what is going to be the impact on our healthcare system. The important things that help us getting through this pandemic, recognizing that transmission in the community and impact on the healthcare system is now affected by 2 things. One is numbers of people in hospital, how long they stay there, but also the fact that this is infecting healthcare workers. And even with illness that doesn't make me go to a hospital myself, healthcare workers having to be at home recovering from their illness has led to staff being off ill in higher numbers than ever before in this pandemic. So in trying to understand that, we've been looking at models, and we look at analogies from other communities and other parts of the world, as I've mentioned before. So one of the things we're looking at is how is our trajectory comparing to other jurisdictions where Omicron has become the dominant variant in a very similar pattern, a very similar time frame. And particularly, we're looking at a couple of urban centers. So that's on the left, and we've compared it with London, which is ahead of us in terms of measuring this over time. Washington, D.C. and New York City are good representations of the movement of Omicron over time. And we can see that our populated urban areas are following a very similar trajectory. And particularly if we look at Vancouver Coastal, I mentioned there's that flattening, bumpy bit. We saw a very similar thing in London as testing capacity was reaching limits there. And so it was difficult to tell for a period of time if we were seeing a slowing down or if it was still going up and we just weren't measuring it. But we can now say with some confidence that the pattern shows a sustained decrease, and that pattern reflects what we're seeing in other jurisdictions that have a similar Omicron dominant outbreak right now. And if we look at this from a regional perspective, BC is following a very similar pattern to what we see in what we saw in South Africa, what we're seeing in the UK, and we've put in there Florida and Denmark as well as 2 other jurisdictions that are going through a very similar situation than we are. Obviously, it's not perfect, and this is just one way that we look at it. We sort of triangulate and look at many different things to see if we can say with some confidence where we are in the course of our trajectory. One of the other surveillance measures that we've been watching over time, and I've presented this before, is the wastewater surveillance. So when we look at wastewater surveillance, it's not dependent on who gets tested. It really is a barometer of how much virus is in a community. And we see that it follows quite closely to peaks that we've seen in the past, and we're seeing that again. The concentrations of the virus that we're finding in the wastewater surveillance that has been ongoing for over a year peaked around the first week of January, which is very similar to the data that we're seeing from the PCR testing, which is very similar to the other surveillance measures that we've been looking at, and that we're now on a decreasing trajectory of concentration. Certainly not back down to the levels that we were seeing in Vancouver Coastal and Fraser in the summer, for example, but on that downward trajectory. So this gives us more confidence that we are, at least in terms of transmission in the community, we've reached the peak and we're starting on that downward trajectory. Of course, the other really important things is the impact on our hospital system. Over time, we've also always been looking at hospital occupancy. So this is census. So this is on a day-by-day basis, how many people are in a hospital in BC with a positive COVID test. This is an overestimate of the number of people who are in hospital because of COVID, but it helps us understand the impact on our healthcare system, in particular on the hospital system. And we've been following this over time. We can see that there's been an increase. Particularly, we were at a nice low at the end of November, and then as Omicron moved into the community, we've started to see this increase on top of the residual increases we had from the Delta wave that we were dealing with most of the fall. And on the very bottom, there is the dark blue is critical care. So that's census, number of people in critical care with a COVID positive test. And this is something that we've been following very carefully, and as we have rapidly changing situations, it's a more important daily measure of the impact on our healthcare system. But it's a composite measure that tells us a bunch of different things, and we need to understand a little better who's included in that census. So we will be reporting hospital census data starting on a daily basis, starting today, which will mean a jump in numbers of people included in that number. And I'll talk through a little bit where we get what that means. Some of the things that we've been following over time to try and understand the impact that Omicron is going to have on our hospitals are things like emergency department visits for COVID. And this is looking at the visits in Vancouver Coastal and Providence Healthcare for the month over the past year up until January 11th. As we can see, there's been a dramatic increase in people going to the hospital, to the emergency department related to COVID. So that may be because of COVID, it may be because another condition is exacerbated, it may be because they tested positive and they have concerns. So those visits have increased, and they're starting to perhaps level off. They have not started to come down yet, so it's an early marker. But what we are looking at really carefully is the proportion of people who visit an emergency department who end up being admitted to hospital. And we can see that that proportion is much less than what we had in previous waves, particularly in March and April and May of 2021, where that proportion was much higher. So that's something that tells us a little bit about severity of illness with Omicron. The other thing that we are looking at is how many people in hospital are there because of Omicron, how many people are there because they've been infected with Delta, which we know causes more severe illness in general. And then, of course, as we've come closer to this week, there's still a number of people who have been admitted to hospital who we don't yet have a sequence, a whole genome sequence, because there's a delay in being able to do those sequences. But what this helps us understand is for those that we know are Omicron, are they in any way different? And this gets at severity of illness and the impact on hospitals. And we've seen in other countries, in South Africa, in Copenhagen, in the UK, that people who are admitted because of an Omicron infection tend to have a shorter length of stay and not as severe illness. So we need to understand if that holds true in our population here in BC. So what we have looked at is for those between the end of November and the 7th of January, looking at people who we know had Delta, people we know were infected with Omicron, and then the unknown. And what this tells us is consistent with what we're seeing in other jurisdictions. So the median length of stay is about half of what we are seeing with people with Delta. So compared to Delta, Omicron, people aren't as sick. And the need for critical care is down by about 2/3. So only 12% of people who are infected with Omicron compared to people who are infected with Delta. And the same thing goes for severe enough illness that it leads to death. So there's a whole lot of caveats here in that we know a younger population was infected early, but it really does align with what we're seeing in other places, that people who are admitted to hospital are admitted at a lower rate and have a lower need for critical care and also a shorter length of stay. And so those unknown people, if we look at the pattern that we're seeing in that 358 people who were admitted in the last 7 days, many of them are still in hospital, and so we can't say anything about length of stay yet. But they are more reflective of what we're seeing with Omicron. So that's telling us that we're starting to see the Omicron impact on our hospitals. And so we need to know, one, is it because of COVID and Omicron that they're being admitted? Or is it an incidental finding? And then we need to have an understanding of how long this trajectory is going to go. So we've been trying, as we have across the country, to try and separate this. This has not been as important an issue before Omicron. Because there is so much transmission in the community, we are now finding that people are being incidentally testing positive. What that means is they're being admitted for something else. Most commonly, we're seeing it people admitted for surgery, people admitted to labor and delivery, or to medical wards, mental health issues, who are being screened with a test on admission to hospital, and those tests are turning up positive. So they're not being hospitalized because of the impact of COVID, either directly or indirectly from exacerbation of other illness, but they're being found incidentally. And this is something we've been trying to tackle with, I mentioned this before, with my colleagues across the country. Ontario presented some data this week on how they're looking at it. This is tricky to get to because it really means we have to do a chart review of every individual case, and we're trying to find a way to automate it so we have a better sense. But one of the chart reviews that we did do was that all of the hospitalizations in the month of December, so it was up until the people who were admitted up until January 11th in Vancouver Coastal Health. And this gives us a representative sample of what we might be seeing in other places, and we have been working with each health authority, and it probably is about the same in each health authority. So what this tells us is that about 45% of the people admitted to hospital with a COVID positive test, it was an incidental finding. And about 50% of them, it was actually because of their COVID diagnosis. And right now, as we're transitioning and we presented what I just showed you, most of the people being admitted to hospital still are related to Delta, so that's the blue in this slide. And people requiring invasive intervention, so that's mostly critical care, ICU, needing oxygen or intubation, again, more likely to be infected with Delta. So this gives us an indication of what we might be seeing in our hospitals right now. It's not across the board, and what we're looking at is how do we get that picture on an ongoing basis. So what we are going to be reporting in our daily hospital numbers will be that composite number of hospital census. So today, yesterday I think it was about 534 was in our hospital, people in hospital. Starting today, we'll be using the census numbers, and that will jump up a little bit. It'll be about 600 and some. And there's a couple of reasons for that. One is because it includes all of these different people. So it includes people related because of COVID. It includes people who are incidentally found to have COVID-19, and it includes people who were part of an outbreak or a cluster in a hospital, so acquired it while they were in hospital for something else. It also includes people who are hospitalized because of social circumstances, and people from out of country or out of province who are hospitalized in BC. So it is the overall overestimate of the impact of COVID, but it does represent the impact on the burden of COVID-related illness in our hospitals. And then as we get the automated processes in place to be able to tease apart these three different groups of people in hospital, we'll be presenting that on a periodic basis as a snapshot. And I know this sounds complicated, but we know that about 30 to 40 people have been admitted a day, and there's an equal number of people that are discharged from hospital. So it's a very fluid situation, and people move into critical care and then back onto the ward and then are discharged. And so it's a challenging to try and keep up with that transition on a day-to-day basis. So what we'll be presenting is the overall hospitalization census, and then on a periodic basis, as we're able to try and automate it, we'll be breaking it down. But right now, about 45% of the people in hospital at this point are people who are incidentally found to have COVID. It does have an impact on things like infection control practices in the hospital, but it does also give us a measure of where we are in terms of impact. We will also be, so part of the reason why we had presented hospitalization the way we did from the very beginning was linking it with our line lists so we can understand severity of illness. How many people in BC who have a diagnosis of COVID-19 end up in hospital at any point in their illness? And that's really important for us to know because it helps us understand the severity of COVID as we're progressing through this pandemic. But that is because it means linking of data. It's a little bit delayed. And so right now where we have rapidly increasing cases, and this was something that became apparent when we started to have rapidly increasing cases in the interior in the summer, those measures can be, there can be a gap and a delay in understanding that. So we're going to be presenting the census on a daily basis, and then weekly we'll be looking at that severity index in more detail. So what does this mean for where we are going and the impact? We've seen that in the community, we're on that downward trend. We need to keep it there, which means we need to continue to hold the line and do what we're doing to try and prevent us being a source of transmission further in the community. But we also need to understand what we can do to infect hospital census. So we looked at our modeling and taking into account the same rates of transmission. So this is what we call the scenario, the higher transmission scenario. Same rates of transmission that we were seeing in December prior to putting in the public health measures that we did, which was stopping nightclubs and gatherings and putting restrictions on places where people were inside. And it looks at booster doses being provided to about 40% of the population. It doesn't look at whether they're the most high risk or not, so it's 40% across the board. And this gives an indication of what we could potentially see over the next little while. It also takes into account, and this aligns with what we are seeing in other jurisdictions, that once you see the peak of transmission in the community, there's a lag of about a week before you see the peak of new admissions to hospital. And then there's a lag of about another week before we start to see a decrease in hospital census. And this model, the bottom on the purple line, it takes into account Delta, the fact that we're still seeing people hospitalized with Delta. The green line is the Omicron impact, and the black dots are where we are right now. And then the orange line at the top is the composite, the total of both of those. So what we expect from this modeling and the trajectory that we're seeing is that our new admissions to hospital on a daily basis are likely to peak between January 15th and 22nd, so sometime next week. So a lag of about a week after we've started to see that peak in community transmission. And with a lower transmission scenario, so this is the taking into account that we put in place some public health measures very rapidly in December as we started to see cases dramatically increase, and before we knew all of the information about severity and who was most affected, if we have that lower transmission, it blunts the peak of hospitalizations, but it spreads it out a little bit more. So the peak might be a little bit later next week. Again, this doesn't take into account. So this is just new admissions, and we'll watch this very carefully, but we expect them to start to decrease, hopefully by mid to end next week. And then about a week after that, we'll start to see a decrease in our hospital census. So this tells us that we need to keep doing what we're doing right now, and that it's going to be a challenging few weeks on our hospitals. We know that this is the peak is coming at the same time that we're still seeing healthcare workers off ill and not being able to go into work. And we've been working very closely in every hospital, every community, to make sure that we can try as best we can to support as much as we can. The measures that we took in December to do things like stopping of non-urgent surgeries, backfilling, health human resource management, putting all of those protocols in place are to try and get us through this next few weeks that are going to be the most challenging yet on our healthcare system. So I do want to talk a little bit about the orders that we put in place. So we needed to do this in December, and I said that at the time that we put these orders in place. There are many things that we look at when we put orders in place. One of them are the factors related to the virus, the transmissibility, how much of it is circulating in the community. And when we were, December 18th is when we had our first Omicron. By that next week, we were seeing it dramatically increase, and we were seeing transmission rates explode in our communities. And that's when we had to think down the line, what does that mean in terms of potential for people ending up in hospital? And you've seen some of the modeling that has shown that the potential could have been quite dramatic even before now. That's one of the things. Then we also look at what are the settings where this virus can transmit more readily, and who is in those settings and what are they doing. So that's where wearing a mask becomes more important. That's where if you're seated and wearing a mask versus exercising vigorously or singing or yelling, whether you're in an indoor environment versus an outdoor environment, whether it's crowded or less crowded, whether you're quiet, your own personal risk and vaccination status. Those are all things that we take into effect. And the fact that we know that vaccine card made a difference in terms of who was in some of these settings, because we were able to understand vaccination status of people in the settings. Plus we look at things like prior outbreaks, what we had seen in patterns over the last 2 years, and transmission change, where they were highest. And that led to us putting in the restrictions that we did around bars and nightclubs, where it's an indoor environment, and gyms as well, and fitness centers, indoor environment with vigorous exercise, or where you're not wearing masks. So the risk profile in those settings is much higher, where we've seen outbreaks in the past, many outbreaks and chains of transmission from those areas. We've also put in, as you know, restrictions on gatherings and events, some of which were stopped for the period of time, others where we put in increased capacity limits for those where people are seated and masked and not moving around. And, of course, really important, recognizing that because there's a lot of this virus in the community and because we have a high level of vaccination, many people will have asymptomatic or very mild symptoms, and they may not recognize it. So that's where things like COVID safety plans in businesses, like the plans we have in schools and daycares and childcare centers, are really important, because it means that you're wearing a mask in those settings. It means there are other measures in place to try and prevent transmission that look at all of these risk factors above. So that is the state of where we are right now in terms of this wave of the pandemic. I will also share that we have been adjusting and trying to understand in real time from multiple sources what's going on and what we need to do. We also need to adjust our measures, and we are making changes to our testing guidance, as we've talked about, but the starting point for all of us remains unchanged. If you're feeling unwell, stay home and stay away from others, and if you're struggling with your illness, seek medical care. If you're a close contact of somebody who you know has COVID, you need to self-monitor and limit your interactions. Wear a mask. If you have mild symptoms, you don't need to get tested, but you need to stay home until you're well enough to resume your regular activities. And of course, you're encouraged to inform your workplaces, schools, or childcare, but you don't need to contact public health. But you need to avoid high-risk settings if possible when you are ill, so it's not the time to go visit older members of your family. But you also need to follow COVID safety plans in your workplace, in your school, in your childcare. If you develop symptoms and are high risk, or live or work in a high-risk setting, then you do need to get tested, and that's what we are preserving our testing capacity for right now. And you need to follow public health guidance, including requirements for self-isolation based on vaccination status, so staying home for 5 days if needed. Given the rate of transmission at this time, testing should not be the indicator to be cautious and to take care. And the data that we've shown, there are some people that need to take care because there's a lot of virus in in our communities right now still. So if you are older, if you are somebody who's going through cancer treatments, if you're on immune suppressing drugs, you do need to take those extra precautions, and we need to take extra care with those people in our communities and our families who are in that category as well. We will, of course, to continue to monitor and adjust as we learn more in the coming days and weeks. My message to everybody today is that we all need to remain vigilant, and we must also use our common COVID sense now. This is different, but it is not something but it is still something that we know how to handle and we know what to do. This is the respiratory season, which means we have COVID. We also have a little bit of influenza, quite a bit of RSV, and other viruses circulating. So the protections you're taking for COVID-19 also help you and those around you with these other viruses. For parents with children in K-12 or childcare, if your children are ill, please keep them home. If they have mild illness, they can return to school when symptoms have resolved and they are feeling better and up to their usual activities. And the same applies for childcare. I know this is different from where we've been trying to make sure we're keeping COVID out of everything, but the reality is that we don't transmit as much if we're well. So these are the things that we need to consider now. And I recognize that clear, definitive, unchanging guidance is what we really want. But COVID is not allowing for that. The virus is changing and we need to adapt as well. It doesn't mean that what you did yesterday was wrong, and certainly we have more and more evidence that all of those things that we did have made a tremendous difference in blunting the impact that this changing virus has had in our communities, and I think that's really important. And I especially am appreciative of everybody being cautious and taking those measures over the holiday season when I know it was challenging and it's hard and we really wanted to be with others. But I'm asking everybody today to do their best and safest thing for my loved one and for yourself today. And that's what we're going to need to do to get us through this wave. But we are resilient and we are strong, and I'm confident we'll get through this wave as well, and very soon get through this storm. Thank you. I'll turn it over to Minister Dix.
Thank you very much, Dr. Henry, and I wanted today to follow up, first of all, by saying that the presentation, PowerPoint presentation by Dr. Henry will be available on the BC CDC website, on government websites, and we'll be sharing it on social media channels as well, because it is useful. I know for people it's sometimes difficult when these are presented and you're watching, say, on television, to see or to spend time with the information that's provided. So that will be available shortly. I want to provide an update on rapid test inventory and use, as well as the impact of sickness on healthcare workers and the healthcare system overall. First, I want to briefly touch, though, on the booster dose campaign. Over the last week, from January 6th to 13th, 319,752 booster doses have been administered in BC, an extraordinary achievement. Yesterday, a record number, 58,685. That's not all doses, that's just booster doses in that period. And I think it was 57,723 on Wednesday. In addition, 378,825 appointments have been made. I want to express my appreciation, because with all of this going on, the booster dose campaign is ramped up to an extraordinary degree, and the people who support that campaign, both the volunteers and staff who make all of the arrangements at stations, our extraordinary team of community pharmacists who do that work, and the healthcare workers who, of course, would frequently be doing other things, and are doing many other things in healthcare that support it and that administer those doses. It is an exceptional success, and as the presentation by Dr. Henry underlines, the decision to focus first on those who are most vulnerable is justified now by the evidence, as we expected would be the case and as is the case in terms of providing protections. One of the most important groups, including was clinically vulnerable people who have massively responded to an early invitation to get their booster doses. But in particular, those over 70. Right now, approximately 77 or 78% of all those over 70 have received their booster dose, and about 85% of those eligible. When you think about it, there are 7 or 8% of people over 70 who've not received their initial, who are not vaccinated. So 85% of those are eligible. But that said, there are still a significant number of people in risk groups who we are urging to get their booster, to call today, to go online today, to book your appointment today. There are appointments available in all health authorities in BC in the coming period, and we need you to book your appointment today. What the evidence showed, it's shown starkly by Dr. Henry, is the need for people in this category. There are currently 53,000 people in the 70 and over category who have received invitations to book. To be clear, the response has been overwhelming and has been positive, but 53,000 who have received invitations and have not yet booked. And I'm speaking to those people today, and people such as me, people with type 1 diabetes who are otherwise clinically vulnerable, to respond and to book your booster appointment today if you have not already done so. This is important for you, for your family, and for your health equally. All those, and it's shown again starkly in this period of Omicron, all those who are still unvaccinated, haven't received their second dose, or who are partially vaccinated, or who are still unvaccinated. Now is the time to get vaccinated. You cannot see more starkly the result of that and the importance of that. I want to say that approximately 155,000 children 5 to 11 have been vaccinated with the special pediatric vaccine provided for them, and that number continues to grow. But that it is an opportunity as well today for parents to register their children. About 190,000 have been registered to date. But I think it's critically important, particularly if you're in that category, particularly if you're over 70, particularly if you're clinically vulnerable, particularly if you have some immune suppressing condition that affects you, to be careful right now and to book your booster dose today. I cannot, I hope, be more clear than that. We've also been closely monitoring sickness levels across health services. especially in hospitals, in long-term care, and home support. And I wanted to brief you and bring you up to date on those numbers. We provided some numbers on Monday, and I wanted to bring you up to date with more information. I can report that for the period January 3rd to 9th, across all health authorities, 21,517 total healthcare workers were off sick due to illness of all kinds, including COVID-19. And as Dr. Henry says, there are a number of other respiratory illnesses, and of course there are many other reasons why people would be off sick. From January 10th to 12th, 11,010 total healthcare workers were off sick due to COVID-19 or other illnesses in this period. So a relative stability, because the weeks are somewhat different. January 3rd to 9th included a statutory holiday and 2 weekend days. So relatively the same level, but a very high level. I think what everyone who's analyzing this would like to know is, well, what's the base for that? There are about 188,000 active healthcare workers in BC, so there's a lot of healthcare workers. And but this is still a lot of people who are affected in some way by sickness, whether it was 1 day or 2 days or more. And I just want to give you some comparisons. I can report that compare it to the previous years. So if you compare to the previous years in 2021, which was, of course, during the COVID-19 pandemic, and 2020, prior to the first case coming of COVID-19 coming to British Columbia, here's what we have for all health authorities except Vancouver Island and Interior Health. So we wanted to get this data to you so you could have it for comparative purposes. So across those health authorities, so PHSA, Fraser Health, Providence, Northern Health, Vancouver Coastal Health, in 2022, this year, 14,591 from January 3rd to 9th. In 2021, that number was 7,573. And in 2020, which was a higher influenza and respiratory illness year, if you'll recall, 8,802 healthcare workers called in sick in the equivalent week, the equivalent week to January 3rd to 9th of those years. So roughly double the number of sickness on a base of 188,000 healthcare workers. This is significant. I just want to say what it means for our system. It means that two things I think that we need to take home. One, this is an immensely challenging time when you have incrementally 10,000 more healthcare workers off sick in a given week, either 1 day or more. That has an impact on services, and we are adapting everywhere. And you've seen some of that adaptation in the last number of days. The cancellation of non-urgent scheduled surgeries, for example, necessary both to free up staff to support people coming into hospital and necessary to ensure that acute care is well protected. But make no mistake about the challenges, not just in our major acute care centers, which are obviously focal points, obviously people coming in with COVID-19, as Dr. Henry has described, but also services that depend on a smaller group of workers, home support services, say, in the Cariboo or in the Kootenays or in the Peace Country, that are affected by COVID-19 with a smaller base of workers where the loss of 1 or 2 or 3 workers can have a profound effect. The message to everyone is twofold. One, yes, we need to be patient in these times, that the amount of healthcare being delivered is unprecedented at every level right now. Our healthcare workers are producing more output than ever before, but we need to be patient because these circumstances are affecting the system. This is the nature of this moment, this wave, this moment in the pandemic. But secondly, if you need care, get care. Don't stay home, don't wait. If you have a serious reason to get care, get care. Do not be deterred by this. Our healthcare teams are doing a remarkable job, not just dealing with COVID-19, not just dealing with the overdose public health emergency, which occupies us enormously every day, not just dealing with every other issue and every other issue dealt with the public, but in providing a high quality of service. There will be challenges, yes. Patience is required, yes. But if you need care, get care. Regarding our rapid tests, as of end of day, January 13, 2022, BC has received 4,859,800 rapid tests total and deployed 3,430,400 of these tests to key strategic areas. That leaves a current inventory of 1,429,400 tests. 563,000 of the current inventory are not suitable for deployment, for takeaway or personal use. They require special equipment, administration by trained health care professionals, and cannot be broken down or repackaged for self-administration. These tests will continue to be used at the discretion of medical health officers in appropriate settings to manage clusters and outbreaks. That leaves 866,100 tests that are more suitable for self-administered use. This week, we have already allocated and sent out approximately 165,000 to acute healthcare facilities for testing of symptomatic healthcare workers, 90,000 for repackaging and distribution to testing sites across BC to replenish their supply. 200,000 are being prepared to support testing of symptomatic staff in the K-12 education sector across the province. Over 100,000 will be deployed for use by businesses and organizations as part of the point-of-care screening program. The balance will be allocated over the week ahead, consistent with the plan that was outlined in detail on December 21st, 2021. In addition, we will allocate existing inventories that are suitable for self-administered use to the following. 100,000 tests are being prepared for deployment to the K-12 sector for testing of symptomatic students. Another 100,000 are being deployed to the acute healthcare facilities for healthcare workers. More will be repackaged and distributed to testing sites. 115,000 more tests are being sent to the First Nations Health Authority. 50,000 will be allocated to assisted living, and 200,000 for post-secondary education for symptomatic faculty and students. The balance in new inventory that arrives will be allocated over the days ahead, consistent with the plan outlined on December 21st, replenishing long-term care, education sectors, and acute care hospitals for staff and testing sites. For almost 2 years, as you know, we've been doing these briefings, and the first one was at the end of January 2020, and a lot has changed. But I want to say some things haven't. COVID-19 is still the same. It still lives to spread. It spreads to live. And in that purpose, it's relentless. It's not interested in our discussions or in our debates. It spreads to live, and we have seen how it can do so again and again in the pandemic. The opportunities we give to COVID-19, secondly, are essential to its survival, and we need to take the actions, follow the guidance and the orders that have been provided, and take the measures we're taking, because when we allow cracks in our defenses, COVID-19 will exploit those gaps. Third, one of the great assets is frankly, our public health teams, who have been exceptional. The Provincial Health Office, led by Dr. Henry, the BC Centre for Disease Control, all of our teams have been exceptional. The guidance they provided, the work they have done unfailingly, every day, 7 days a week, is a huge asset to British Columbians. And I, for one, am grateful to them and to Dr. Henry for those efforts. And that brings us, I think, to the fourth thing we know, that the greatest asset in our battle against COVID-19 has been and always will be us, each one of us. When we hear about the challenges in our hospital sector, there are things we can do, both to protect ourselves and to support our healthcare workers, including adhering to orders, following guidance, using masks where appropriate. Every time we choose action over delay, attention over disregard, awareness over denial. And finally, I would say that in battling COVID and maintaining our humanity while we do, what matters is what we do in the moment. If you haven't been vaccinated up to now, get vaccinated and join the fight. If you haven't been following all the rules up to now, no judgment. Start to do that. Start to support one another. Protect those that you love and those that you don't know. We need to, more than ever before, rededicate our efforts in these next weeks, these difficult weeks for our healthcare system. And the information that we provided today illustrates that while cases may have peaked, hospitalizations have not. And we need to work together to support each other in these difficult times. And with that, we're happy to take your questions.